federal government is ready and they are serious to meet all our demands. So it's indefinite. We don't even know when it's going to end. No patient is presently on any of these beds telling you how effective it is. And none of our members that are staff of this hospital, none of them is on ground, apart from doctors. Even doctors have deserted this place. They have gone outside looking for PPP to do because work is not going.
This is a time that the government has to be more proactive to save lives. These people have been ditching work, and I can tell you, considerable number of things is going to be affected. For now, nobody can ascertain the people that could have died due to this industry.
We want the full implementation of the agreement US entered with the federal government, and that's just the bane of it all.
Joining us from our Abuja studio is the president of the National Association of Nigerian Nurses and Midwives, Comrade Abdurrafiu Adeniji. Good morning and thanks for joining us on the show. Okay.
Good morning, TVC team. Good morning, the viewers.
Yes, indeed. Thank you very much. Okay, so now it looks like the government is on the same page as the NMA that says Johesu's strike is actually against the doctors. And, you know, that doctors cannot earn the same thing, or Johesu cannot earn the same as what doctors are earning.
Well, I am, for the benefit of doubt once again, trying to clear air on the issue of the Johesu strike. And it's not all about bad blood, it's not about envy. It is based on very objective, individualistic, and group interests. The Nigerian health sector comprises of multidisciplinary people. We have doctors, we have nurses, we have pharmacists, we have physiotherapists. All these people are trained in the area of their own specialization and are delivering their services to the benefit of healthcare consumer. And the patient is supposed to be at the center, I repeat. Saying by the Federal Ministry of Health or NMA that Johesu health workers are looking for equal pay, it is misnomer, it is misinformation, and it is calling a drug a bad name in order to be able to hang it. We must be reminded once again that what we are clamoring for is not based on the fact that government is not paying adequate adjusted salary to health worker alone. We have said more than 1, 2, 3 times that we are talking about those policies that will bring about quality healthcare services to the masses, those things that will strengthen the healthcare policy formulation, execution, and evaluation. Those factors that will ensure that health workers stay in Nigeria and they are not moving out of this country. Those things that will end disharmony in the health sector. For the avoidance of doubt, Johesu is asking for adjustment of Cohen's salary. We have 2 salaries in the health sector. We have Cohen's salary. We don't have business with Cohen's, which is for medical doctors. Our business is with Cohen's salary scale. And what we are asking from government is an adjustment of this one. And even among, for your information, among the Johesu members, we have our salaries not equal. How can we now be calling for something that is personal emolument to say that pay me the same salary with doctors? Okay. I am a nurse, I'm proud to be one. So whatever is due to a nurse in Nigeria, I'm ready to abide with it.
All right,
so also my members.
All right, Abdurrafiu. Now, the position of the government at the moment is that it will adjust the wages of the nurses and the midwives and the rest of them. How does that sit with you? Hello, Abdurrafiu.
Well, it looks like Comrade Abdurafiu didn't
Hello,
hear your question.
Abdurafiu, well, if you can hear me, let me repeat my... Hello, Abdurafiu. Hello. All right, Abdurafiu.
Hello, I'm hearing you.
Okay, great. Well, I'm saying that in response to your own position, that the federal government has said it will respond by adjusting the wages of the midwives, the nurses, and the rest of them. How does that sit with you?
Actually, what we are asking for when you look all through our papers is adjustment of this current salary. And it is not new negotiation. Agreement has been reached. The total bill has been put across. And the moment they do this, we are not ready to continue to prolong the strike for a day. We met last week, and the solution that we have on ground is that what they are still offering does not see that the government is ready to really address the issue that is on ground. The moment the government addresses the issue, USU will come back to work.
What is government offering at this point? Because the Health Minister, Isaac Adewale, said recently that government has met Johesu halfway by paying up all the outstanding salaries and all of that. What is government offering now?
Government, we are still at the negotiation table. And when you start negotiation, I have not seen the government meeting the Johesu midway. And for the benefit of those people who have been misinformed, the government is here to actually say what they want to do. Our next meeting is to table the statistics. How can we end a negotiation without substantive statistics? So the statistics is what we are sitting down to look at now. And the moment whatever the government is offering meet our demand, we are going to the strike is coming to an end.
What statistics are you talking about? Give us a clear picture of what it is, please, if you can.
The statistics of number of health workers, the statistics of what is going to be the increase, what percentage is to be offered, and what is the total amount of the wage bill. Okay.
All right.
The government have their own side. We also have our own side of the calculation.
All right. So what is our issue here is the 2017 pact that you signed with federal government vis-a-vis your allowances and wages and all of that. So now you are saying that if the government comes up with their own position, you are ready to listen to government. Hello, Abdul. Hello, Abdurafiu.
Hello, I cannot hear you.
Hello, can you hear me now?
Hello?
Can you hear me now? Can you hear me now?
Yes. Yes.
All right. I said earlier that
yes.
What is at issue at the moment is the 2017 pact that you signed with the federal government. So what I'm asking is, if the government comes up with a position that you are ready to sit with government and then resolve the issue, because the people who are bearing the brunt at the moment are the mass of the people out there. I love the Abdurafiu.
Well, the plight of the masses is what is making Johesu consider what the government is going to offer. The 2017 agreement had already concluded the negotiation. We are left with implementation. Even though it has been part of the Nigerian government to sign an agreement and not honor it. But I want to reassure the masses and call on them as well to understand our position. We don't have an hard line position. And that is why we have been attending to the negotiation. At every beck and call of the government, we have started with the government to deliberate.
Well, you say you don't have a hardline position, but you've said it's going to be a fight to finish, and yet Nigerians are dying. Are you able to put a figure to the number of Nigerians who may have died since your strike began? And how does it come to you?
Well, it's so painful, and we should place this blame at the door of the federal government. We have exercised patience. The people that are being affected, we have our members. And what we are calling for is that the ethics, the international ethics of practice in health sector is that put yourself in a better position to be able to render qualitative and safe healthcare services to the masses. But if yourself is not in a safe position, you are not going to render qualitative and safe healthcare services. And in this instance, you are liable and you can be tried in a law court for rendering substandard healthcare services. Those people that might have suffered the brunt of this strike, we share their pain because they are our people, and then we are among them. But let all of us join hand to appeal to federal government to do the needful. When you know you want to do a thing, why not do it at a time? Instead for the government to be issuing orders that will not promote industrial harmony, like go and take a security agent, coerce people, going against the ILO convention of employing locum, which is casualization, they better sit down, come up with substantive and very realistic negotiation. They are just deceiving us at the table. That is what I see about it. And they are making the Nigerian populace to believe that Duesu is fighting an unjustified cause. If it is an unjustified cause, why did they sign the agreement in 2017 to bring a strike action of 2017 to a halt then? That's when we suspended industrial action.
Thank you very much, Abdurrafiu Adeniji, President, National Association of Nigerian Nurses and Midwives. Of course, government has talked about the no work, no pay rule. I wonder how that's going to play out. Thank you very much for joining us. We hope that this will be resolved sooner than later.